excited to tee off our panel discussion on consumers take control. The reason for my excitement is just the unique position that India is in today. We've just become the fifth largest economy in the world. We have such widespread adoption of technology across all tiers of our geography. And we have a significant expansion of the consuming class, which has not just the ability to spend on healthcare, but also has the propensity to spend on healthcare. At the same time, the expectations of these consumers of healthcare are also evolving, and they're increasingly asking for a better experience, higher quality of care, and improved outcomes. So to discuss these trends and their implications, I'm honored to introduce our panel speakers, Dr. Rushika Fernandopulle and Nandini Piramal. We'll try to cover this discussion across a few different dimensions, one of them looking at learnings from markets like the US and what might translate through to India, and others from learnings on the Indian market as it's evolved. And the other dimension is really healthcare services versus products for healthcare. I'll first introduce our panel speakers. Rushika is the Chief Innovation Officer of One Medical, which is a leading advanced primary care company based in San Francisco, and is actually in the exciting stages of being acquired by Amazon for about $4 billion as we speak. Prior to this, we've had the privilege of partnering with Rushika from his time as the co-founder and CEO of Iora Health on his mission to transform the delivery of primary care in the US market. Rushika serves on the staff of the Massachusetts General Hospital and also on the faculty of Harvard Medical School. Welcome, Rushika. And joining Rushika on the panel is Nandini Piramal. Nandini is an executive director of Piramal Enterprises. Amongst her responsibilities, she leads the over-the-counter business of the Piramal Group. And under her leadership, this business has emerged as one of the fastest growing Indian consumer health franchises, with multiple brands being leaders in their respective product categories. Nandini has been recognized amongst India's most powerful women by Business Today and also as a young global leader by the World Economic Forum. So thank you, Rushika. Thank you, Nandini, for joining this discussion. I'll probably like to tee off the discussion with a couple of questions to you, Rushika, to just understand how consumerization is impacting the delivery of healthcare services. But maybe before I jump into questions, the Marvel movies have taught me that every hero always has a fascinating origin story. And so Iora Health was amongst the leaders to disrupt primary care management in the US. Can you talk a bit about the journey of Iora Health and One Medical?
Sure. So thank you. And it's great to be with you. So the history goes back almost 20 years. I was a primary care doctor, and practicing at Mass General Hospital. And it was really clear to me that the model was broken. We had largely good people, good intentions, but the way we were delivering care was awful. It was bad for the consumer. It was bad for the doctor. It was bad for the system. And I think the simple insight is what everyone else, that wasn't a secret to anyone, but everyone else is doing is what I call the incremental change model. They would try and take an existing practice or a hospital and tweak it a little bit. And the simple insight is maybe we needed to simply start over, and that there was a difference between improvement and innovation. So the analogy I often use is, imagine it's 1902, I'm in Boston at the moment, and say we wanted to get to London, and all we have are ships, right? So you could study the ships, you could streamline the hull, you can put a better engine in the ship, but it'll never get you across the Atlantic in less than a day. What you need is an airplane. Right? And the way you build airplanes is not by putting wings on ships. The way you build airplanes is you build airplanes. So I said, maybe we need to build an airplane here. So at the time I was running this interfaculty health policy program at Harvard. So on their dime, was able to do some thinking and travel around the world and visit people and say, what if I was going to start over and build a new model? And what's the key is, instead of the current healthcare system, which serves itself, not the consumer, and it's trying to do more things to people because it's largely paid fee for service, what if we said we wanted to build relationships, not transactions, and actually improve health, not do more things to people? What would that look like? And so we started with a little practice. And so I went to all the big health systems in town, by the way, the Mass General, the Brigham, and I said, look, I've got these ideas. Would you let me build a prototype practice where we can try something new? And they all sort of pat me on the head and say, that's really interesting, but our practices are full. We're making money. What's the problem? And I said, care sucks. Patients hate it. Doctors hate it. Bankrupting the country. But you realize those aren't their problems, right? Again, we built this medical industrial complex. that's not really geared toward serving the consumer, it's serving itself. So I said, I'm just going to do it myself. I'm a doctor. I could start a little practice outside of Boston called Renaissance Health, Rebirth of Primary Care. And we started with, and change everything. So change the process. We had to build a different technology platform. And then the key in healthcare is you have to change the business model. So we started with a retail model, which is very much like in India, where we told people, look, your insurance company is too stupid to pay for the right things. So if everyone paid us $20 or $40 a month, we'll get on with it and we'll be able to innovate and do something different. So we did. We built the practice up. We then pivoted it to serve employers, which is where a lot of people get their healthcare from in the US, the Boeing company, the Casino Workers Union in Atlantic City. Then about 10 years ago, decided we're going to raise some venture capital money. Actually, one of our first funders was from Fidelity Biosciences, your sort of equivalent over in the US. And we started building this in a variety of places. Starting with college employees, the hotel workers in Las Vegas. And then about 7 years ago, realized that this model works really well for older, sicker people. In the US, they have a program called Medicare, where the government actually pays for their insurance. So we started working with Medicare and Medicare insurers like Humana, and then it really took off. So we got to 50 practices. We started contracting with other health plans. We directly contracted with the government. We got to about $300 million in revenue. COVID hit, and it realized we were a COVID-proof business. Our payment model, which is basically we get a fixed amount per patient. Doesn't matter how we see them. We could see them by video or text as well as in person. We were on the road to going public ourselves when we got approached by a number of potential acquirers. And we chose almost exactly a year ago to close a deal with One Medical, which was a sort of a sister advanced primary care company that was focusing largely on the younger people. We focused on older people. Nice combination. And then, as you said, about a month ago, we announced that the combined company was being acquired by Amazon. It's not closed yet. Still an independent company, but hopefully in the next several months that'll close. So that's the short version of the journey.
Fascinating story of non-linear thinking, Ruchika. No, thank you for that. And just continuing on that thread, we hear about big tech companies, whether it's Apple or Google, all of them thinking about healthcare in a very meaningful way. I'm curious as to what a big tech company like Amazon thinks about healthcare and what might be, their lens on a sector like this, given their interest in One Medical.
Yeah. So again, to be clear, I don't speak for Amazon yet at the moment, but I'm speaking from my perspective. So first, it's a huge economic opportunity. It's $4 trillion in the US alone, probably 10 or 12 globally. It's 20%, 20% of the US economy. And I think when you're a big company like Google or Apple or Amazon, and you're thinking about how you're going to grow, you have to go into healthcare, right? There's sort of no way not to. Number two is that the superpower that I think all these tech-powered companies have, particularly Amazon, is that they're very consumer-centric. They are built to help serve the needs of consumers. And guess what the prime problem in healthcare is it's not very consumer centric. We make people wait. We treat them like crap. And so this is a huge opportunity, and maybe we could do something about it. Our customers are telling us this is a pain point. They tell Amazon, they tell Walmart, they tell Google. And so they said, and third is healthcare is a data intensive business, right? So if the goal is to optimize outcomes, data has a huge role. And that's what these companies do for a living, is take data and make sense of it. So for all those reasons, it makes a ton of sense to do this. By the way, Amazon is a fourth superpower. So if you think about it, people like us for years have been trying to lower the cost of healthcare. Cost is price times quantity, right? Economics 101. We've only been able to work on the quantity lever. So we reduce hospitalizations, we reduce ER visits, we reduce unnecessary procedures. But we, as a little startup, haven't been able to touch the price of every service. Guess what Amazon does really well? Is they rationalize pricing. They've done it in every other industry. So imagine if you could use sort of our superpower of getting the right quantity and Amazon's superpower of getting the right price. Now, all of a sudden, you can make a real impact on this. And so I think that's what's exciting about it. They're all doing it. By the way, they're all interested. They have all futzed around and I think largely have failed, to be quite honest, right? Amazon pulled the plug on Amazon Care. Haven was another big thing. Walmart's been trying all sorts of stuff because healthcare is hard, and unfortunately, it's not as easy as building a tech company. And so I again, my glass half full view is the fact they're willing to put almost $4 billion on the table to purchase someone like us. Maybe mean they're finally serious. They're not going to just sort of futz around at the edges, and they're going to make some real investments in the space.
Thank you, Rishika. That was super helpful. And I'll come back to you with a few follow-up questions. But right now, Nandini, I'd like to transition to you and have a few questions around the India market, and importantly, how the consumption of healthcare products is evolving in India. And of course, the Piramal Group has been a pioneer in building an independent domestic consumer healthcare franchise. Would love to hear from you how the behaviors and expectations of healthcare consumers in India have actually evolved over the last few years. And more specifically, has the pandemic led to any systemic changes in healthcare consumption?
Thank you for inviting me, Ashish. It's a pleasure to be here. If I think about it, the consumers in India actually now have much more choice than they did before. If you think in the past, if you go to a chemist shop, you kind of have to stand at the counter, you're hurried, you can't see what the guy has at the back. And quite often, the chemist used to be the decider of what to give you. Now, I think you've got both for a small portion of consumers, both online as well as modern trade, where you can choose. And I think that has changed how products and brands get in front of consumers. With the pandemic, I think online has sort of exploded like everyone else. And it's got enough to be scalable. But I think I still want to say is old school distribution still exists. It's actually going to give you the most scale. So I think if we think about just D2C, direct to consumer, only online, maybe modern trade, you won't get scale. So if you look at some of the other companies, even those who started out is just direct to consumer are all now building their own physical footprint or using other distribution systems. So I'm a big believer in that you have to be both. You have to be online and offline.
Got it. That's really helpful. And are you seeing consumption changing materially, Nandini? Are there certain areas where consumers are just behaving very differently?
I think as the population gets more educated, both about health and about, whether through the internet, or even they're willing to get other sources of information. I think people are making the choice on their own. They may still want validation from whether it's a doctor, the gym teacher quite often, or, even their friends, but they're actually willing to go out and try new things. It used to be in India, if it was a tablet, you only went to your doctor and you'd never go beyond that, right? But I think people are beginning to take their health much more seriously. They're willing to do a lot more preventive healthcare, and I think it's sort of an exciting place to be in.
That's fascinating. And I'll probably, extend on that train of thought. You spoke about direct to consumer brands and how technology is also an enabler. And the first and second panel discussions we've had today have also, spent a bit of time on technology. And on the pharmaceutical side, we see technology transforming the way drugs are discovered, the way they're manufactured, the way they're distributed, and also how doctors are made aware of them. And I'm curious if how you see the role of technology in facilitating this trend of consumerization of healthcare, either in terms of driving access or, consideration and choices, or eventually improving outcomes. Any trends that you could touch upon?
I think the first I see is actually it is definitely consumerization access, because if you can do online, you can actually, you're not limited by the space on the shelf. So as we think about it, one of our critical things is we use online as a way to get scale into proof of concept, and then take it out to the sort of broader India, right? So that's one way of access, but also even you have a lot more space to explain to people what your product is for. Online, you can actually have a two-way conversation, which is much harder. Because traditionally, as a brand, you would only talk one way, right? But now you can actually have a two-way conversation And I think that gets, consumers more emotionally engaged in the brand and the product as well.
Got it. And I think a similar question, Ruchika, maybe from your lens, as you think about the thread of technology, I was wondering if there's a way to translate learnings from Iora Health and take that model and perhaps apply it to India. What opportunities do you see in a country like India to balance cost and clinical quality in, say, chronic diseases like diabetes? And as you know, we have a significant population segment that pays out of pocket for healthcare. Would love to get your sense on what learnings from the US might translate well into markets like India.
Yes, maybe we start with the problems we solve, right? To channel one of my mentors, Blake Christensen, we think about what ought to be done to need. And, the problems of aging populations, either yourself aging or your parents aging, and you probably, as a speaker before said, you don't live in the same city anymore like you used to. And then number two is chronic disease, right? But unfortunately, this is happening all over the globe, is these NCDs, non-communicable diseases, diabetes, hypertension, heart failure, depression, arthritis. They go along with aging. It's what happens. And I think so the problems are no different in India than in the US. And then number two is, I think, the current state of the fragmented, reactive, non-consumer-centric health system is no different than in the US, right? You spend 7 minutes with the doctor. They don't really keep very much records. They don't really engage you in your care. It's, it's a system that's built around acute problems, not around ongoing relationship for chronic disease. So I think the problem statement is very much similar. Number two is, I think, the clinical model that we've developed using health coaches who are from the community, leveraging technology for those health coaches to drive the right behavior, leveraging data about patients to try and improve outcomes. All of those are very similar, right? And I think could easily be applied. The part that's different are the business models, right? Because of the payment system in India versus the US, and we'd have to evolve the payment models to do so. But that's doable. We've evolved even within the US, as I mentioned, from retail to employer-based to government programs to health plans. And I think you do the same sort of thing. On the One Medical side, we have a pretty big continued retail business where patients pay us a small membership fee. It's about $200 a year in return for us sort of managing these conditions. So again, I think there's a huge opportunity in India. The problems are all the same. The current state is still the same. You need to get a little creative about the business models.
Got it. That's really insightful. And Nandini, on the same theme, as we talk about innovating business models, the Indian market has seen a tremendous amount of growth in this segment, predominantly on the back of more product-led innovation. I'm curious as to how you see the next wave of innovation in the consumer health segment in India, and what dimensions they might be.
I think it'll ultimately be if you can make the wearables idea work along with products, right? And it goes back to what Ruchika was saying, which is if you can do a managed care thing that links everything, right? Can you interpret your blood sugar scores and titrate your medicine along with that? I think that's the exciting part.
Got it. And are there any categories within the market that you think are poised for some kind of nonlinear growth?
I think around the whole wellness and vitamins, I think that's a category that's still in India got a long way to grow. Like if I look at the US and what consumption is there versus here, we have still just a long way to grow. But I'd also say we as a company or as companies have to prove to Indians that where there's a value for money, right? Indians still have a very much a value for money mindset. And so we have to show them why does something work. I think the other one is the people who can actually really consumerize the traditional healthcare, Ayurveda and other things like that to make it accessible, understandable, and useful, I think also will continue to grow.
That's really helpful. And I have a couple of questions that I thought to pose to both of you and maybe get different perspectives on perhaps the same question. One of them really is, some advice you might give to founders of healthcare companies in India. What we're seeing is the needs of healthcare consumers, today are being targeted by companies across multiple sectors, be they retail, technology, or consumer goods. They're all converging on the problem from different directions. I'm curious as to how you should, you as a founder think about the end game in terms of providing a consumer experience, given that these lines have started to blur, and how other entrepreneurs can learn from your insights. So, whoever can go first, but would love to get both perspectives on this.
I can go. I'd actually say don't forget about quality. At the heart of it, your products and your quality should be such that you're willing to give your kids, your parents, and you have that confidence in that quality. A lot of the new startups, I'd say, are probably taking shortcuts, which will come to bite you later. So I think if you put quality at the heart of it because you want to serve patients and improve their lives and improve outcomes, just don't forget about it. It costs money. It takes time, but in your rush to get to market, don't forget about that.
Got it. Quality is the number one priority. Rushika, any thoughts from your end?
Sure. So first of all, I completely agree, Nandini, that trust is so important in healthcare. And the second you lose the trust of consumers, it's a game over, right? So I think, and yes, it's more in the beginning, it may be more expensive and it may be a longer game, but it's very important. I think number two is it's very tempting in healthcare to try and build companies that serve the healthcare system, whether it's hospitals or doctors, et cetera. And often that's who people end up selling to, but then they forget about the consumer, right? So always have the consumer, and the consumer doesn't care about our little buckets of, a doctor, a hospital, health plan, et cetera. So think of it from their point of view. And then the third insight was segment the population, right? I think one of the things we do in healthcare is we build, say, medical practices that are trying to sort of do all things to all people. And no business in the world would actually try to do that, right? No one would open a restaurant and say, I'll cook whatever food you want. I cook Italian and Greek and Indian and Chinese. And no, I want to make an Indian restaurant. You want Chinese food, go over there, right? So pick a population, it's a huge field. It's $4 trillion in the US, like I said, 10 or 12 globally. You can't serve all of it. Pick a segment and get really good at serving those people. Right. And I think someone else talked about not getting distracted, like get good at that. Eventually you can broaden out to other ones. I think our choice that we're going to serve seniors who are low income and do it really well, we outperform anyone who's trying to serve every person who walks in the door. So segment the population, serve them well.
I think we momentarily lost Rushika, but he was on the trend of segment the population and serve them well. Yes. Yeah, Rushika, you're back. Please continue.
Yeah, again, segment the population, serve them well, because if not, there's no way that you will actually be successful. And then, focus on the consumer, right? If the end game is actually improving outcomes, I, the doctor, we, the healthcare system, cannot improve outcomes. Only the patient and their family can, and we need to give them the tools to do so. So we have to engage them.
Got it. And again, I guess a question to both of you. You both spoke about the need to be consumer centric, and that's not necessarily something that every organization gets. They target either the provider or the payer, or they have a slightly different lens to it. How have your organizations built this consumer centricity, and are there ways that you tap into to really understand the journey of the patient or the consumer?
We actually have pretty much our entire team spending at least a couple of days a month in the market, right? Following both the sales guy, but also meeting consumers across. And then everyone comes back, and actually you used to have what I would call the Khichdi meeting. In those times when you could meet, which was everyone would come, eat khichdi, and also then discuss what they learned. And that's that was kind of the idea of it, is that you get all the mixed vegetables and put them together, and you get a better idea as to what's going on. You get a good, tasty product out of it. So I think you have to go out and meet consumers. You have to go out in the market and see what's happening, be aware of what competition and what are the changes in, business models that are actually going on.
Got it. No, thank you. And go ahead, Ruchika.
Yeah, and I just got back from visiting a number of our practices in Seattle, right? There is no substitute for your executive team spending time in the markets with the customers. Number two is you just collect a ton of feedback. So every encounter we get, so a lot of people, when they track patient satisfaction, once a year they do a survey, right? That's not good enough. So every encounter, every day, we ask people 3 questions. We ask a net promoter score. How likely are you to refer this to a friend or a colleague? What did we do well? What can we do better? And literally every day that feedback gets fed back to the teams. And then I can look at it, at each practice level, each market level. And then it really is about a signal. If you see this sort of taking a dip, then you know there's something going on with customer service in one of your practices. Again, they're doing a multi-unit service business. And then you can go and figure out what the problem is, right? So I think it's being in the market and just getting a ton of feedback.
Got it. Yeah, I think there's no substitute for direct feedback, especially as both of you said, you're thinking about a very large opportunity and you can't do something incremental to really capitalize on it. And I guess, taking a step back and looking at the big picture from both your vantage points, could you talk about key trends that you think will play out in India over the next few years in this whole consumerization trend?
I think actually it'll be interesting to see in this funding cash burn winter, which of the products and which of the companies will make it, right? Because I think scale is in our country will be incredibly important, and also value for money. So which of the companies that are really solving consumers' problems, those are the ones that will survive. But I think those days of cash burning and, negative unit economics is just going to go away.
Right. Yeah, I think it's several. So I think that the need for these sort of improvements in health, aging populations, chronic disease is going to keep going. I think consumers are going to become more consumerist everywhere in the world, right? Because in every other segment of the economy, we're used to this, better customer service. Think about, buying airline tickets or booking hotel rooms or, investments, et cetera. And consumers are also getting more and more tech enabled, right? So I think you're seeing that going down the income spectrum. We see it going up the age spectrum. My 80-year-old mother is on Facebook and is using her phone to do things. So I think those trends, I think this trend toward personalized care, medicine has done a lot of this one size fits all stuff. And we're learning that's ridiculous, right? That we need to know about you, your preferences, maybe your genome, your proteome, your microbiome, and then make sort of personalized recommendations for you and not this sort of one size fits all recommendation. I think all those trends will continue.
Completely agree. I think this whole trend of personalization is the next big thing. And I do want to, ask a few questions that we've been getting as this panel discussion has progressed from the attendees in the audience. And if it's okay, Nandini, maybe I can start with you. I think one of the questions we have is, how can a brand achieve differentiation, especially since we're seeing now a plethora of different companies targeting perhaps the same end problem and solution. And so, any thoughts on what drives sustainable differentiation?
I mean, I think it is R&D, but also can you figure out how can you connect to the consumer emotionally and figure out how are you solving that particular consumer's problems, right? Where are the gaps in the market and how can you actually reach out to them? I think that I see is the critical part.
Absolutely. And in terms of the outreach, any thoughts on which channels are more effective to build that consumer connect?
See, I think first is I mean, you have to get people to try it. So I actually like online as a way of generating trial and feedback. The beauty of Amazon and Flipkart and others is that once you can get a lot of noise, but you actually get real gems of feedback there, right? And so actually using that and using it as a way to get to generate trials and building scale that way. It's a long process. It's not immediate. You can't, it won't happen tomorrow, but it'll take time.
Got it. Got it. No, that's good advice. And I'm sure a lot of the audience members will benefit from it. Ruchika, the next question I think is for you. I think one of the audience is very keen to understand what were some of the learnings and challenges that you faced in actually trying to implement value-based care in the US market. And where do you see that moving towards?
Wow, it's a great question. I mean, I could talk hours about this. You know, if you look at our business model and doing value-based care, or maybe I'll do, you know, so first of all, doing value-based care, which is where you're accountable for people's outcomes, improving their health, lowering their hospitalization. It's not a little different than doing fee-for-service, doing more stuff. It's completely the opposite. So the point one is you have to decide which side you're on. And there are a lot of practices and companies that are trying to do both, and you can't do both, right? So you gotta commit and go in one direction. So that's one key learning. You know, the second is if you are then going to sign up, we're going to be accountable for people's health. It's a long game. It's not a short game, right? So the second you snap your fingers, it doesn't change their behavior, reduce their hospitalizations. You have to build the relationship, get their trust, get them to change their diet, get them to take the right medicines, and then good things happen. So, like if you look at our business model, by far the most important variable is actually patient retention. If you can get good patient retention, this is a great business. If you have crappy patient retention and they're churning all the time, it's an awful business, right? So, you know, the CAC to LTV is what it is, right? So the long-term value of a patient for us is tens of thousands of dollars. The acquisition cost is maybe $1,000. So again, if they're churning a lot, then it's never going to work. So that's why this consumerism is not just the right thing to do. It's also a great business thing. Because you keep the patient, now all of a sudden this is going to work well. So we spent a lot of time focusing on how you actually can build processes to keep those patients with you.
Got it. No, that makes a lot of sense. And there's another question on that same train of thought, Ruchika. So maybe I can continue with you. But I think one of the audience members is keen to understand what were, you know, specifically some of the gaps in the primary care ecosystem in the US that you saw as being the glaring opportunities to solve for?
Yeah, so several. So one, which is changed a bit, omni-channel care delivery, right? So in the past, particularly pre-COVID, the only way you could interact with a primary care doctor is you had to show up in the office, take a day off from work, schlep in, fight traffic, wait for an hour or two, right? It's ridiculous, right? Now, are there times when we ought to see people? Absolutely. But are there other interactions in the context of a relationship that we can do it by video or telephone or text message or email or a variety of other things? Sure, right? So that's one, it's just omni-channel delivery. The second one is, again, almost all primary care is reactive. They sit in your office and you wait for people to come in. And if they don't come in, you don't think about them. That's completely silly, right? Because the people getting into trouble aren't the people coming in. They're the people who are not coming in. They're sitting on their couch, eating unhealthy food, you know, and festering in their disease. And so what you need to do is build systems to get data from these people, wherever they are, and be able to reach out to them to be able to get them in if you need to, right? So a simple example is, you know, in most doctors, you prescribe a medicine and you have no idea whether people pick it up or not, right? Whereas what we do is we actually get a data feed from the pharmacies to see if it's filled and we match it with our prescription. And so if the patient doesn't fill the med, we can reach out to them and say, hey, what happened? Why didn't you pick the medicine up from the pharmacy, right? So we know our what's called compliance rates. Most doctors don't have the foggiest idea, right, what those are. Right. So I think, and then maybe the third one I'll add is this building a team, right? So I'm a doctor. I think we're really important. But what we are trained to do is diagnose and prescribe. So we tell people what to do. And actually, the old system, so you would come to see me, Ashish, and I'd say, you should eat less, exercise more, take your medicine. Good luck, sucker. I'll see you in 3 months. And then you'd come back in 3 months and you haven't done it. You bad, non-compliant patient, right? It's ridiculous. So that's why we evolved these health coaches who are people from the community, speak the language of the people they serve, and they're picked for one thing only, which is empathy, being able to connect to human beings. And their job is to work with the patients after our visit to make sure they're actually executing on the plan, right? So again, lots of little things where the current system just didn't do the right thing.
Yeah, and I think the point you made on empathy is fascinating because, we sometimes neglect the softer aspects of what is a very personal journey for the patient or the consumer. So that's actually very interesting. And Nandini, maybe I'll move to a couple of questions to you. Very interesting one. I think, one of our audience members says that, of course, consumers today have, started to plan ahead and they're researching things more, much more upfront. But traditionally, as you touched upon earlier, the doctor has been an important source of recommending products and at some level is a stamp of approval on its quality and efficacy. And so how do you think about this trade-off between working with doctors to communicate, the more scientific and clinical aspects versus going directly to patients, to really build the brand? And is there an inherent, challenge or push and pull between both these models?
There is a challenge because if you think about it, doctors also see themselves as sort of teachers. So they want to kind of what's new, what's latest. And there is a regulatory bright line to some extent is if it's on prescription, you aren't allowed to advertise it and consumerize it quite the same way. So there is a balance. So, if it's a consumer product, at least you can advertise it and reach patients that way. Whereas if it's a prescription product, you have to go through the doctor. There's a whole bunch of products out there that are owned by pharma companies, which are, actually pretty much what they call OTX, which is, they're pretty much prescription free. You can buy them, but they still haven't got to that same scale because as pharma, that's actually why we separated it out, because as a pharma company, sometimes you like having those products in your back pocket because they sell themselves. So there is a push and pull.
Yeah, no, absolutely. And maybe I'm dwelling on now, some past history that I have with the Piramal Group and with you, but I know you've successfully managed to, transition brands from being prescription only into, as you said, OTX, which is a mix of some prescription support and also, a strong consumer demand. Any learnings from that journey that, would be relevant?
It takes a long time. I think that's the thing. You have to be, it's taken us 10 years to get somewhere. You have to be patient. But I think actually getting more and more trials out there and getting that, it's a business to scale. So if you can get to scale as fast as possible, then you can see the fruits of that.
Got it. That's very helpful. And certainly I think relevant to a lot of consumer health companies looking to take this route. And I guess the next question, Nandini, directed to you is, you currently wear multiple hats. One of them is, of course, as a founder and operator, and the other is also as an investor. And so, I think to entrepreneurs in the audience, could you talk about how you evaluate consumer health franchises from an investment perspective, and what are the do's and don'ts that would make you think about them, positively or negatively?
I think one is scale. So it goes back to if you have a lead brand, how much of a share of your total is there? Unit economics. As an operating company, we don't, unfortunately, get some of the benefits of startups. People ask us about operating margins and EBITDA and other good things like that, cash flows. So that's the kind of thing. And then we look, what's your road to profitability? What do you have an idea of where and how you're going to get to, profitability? And I will say a lot of startups still haven't figured out that golden path.
Got it. So it's very much unit economics, focus on not just scale, but also the bottom line that's sustainable.
So unfortunately, I'm old school. I couldn't do your business. So, the old school part of me says, where's the cash?
I think that's very much the flavor of the season, Nandini, for all of us. So that's absolutely very timely and maybe, super relevant to all founders at this stage. And an interesting question for you, Rushika, I think from the audience. I think they're curious as to how you built, patient adoption and demand for Iora Health's offering, and then of course now One Medical. Were there any specific, go-to-market models that you use to really acquire and build scale?
Yeah, so I guess a couple things. So when we first started, we thought that we would, contract with these health plans like Humana or even an employer like Boeing, and then the patients would come, build it and they will come. And that's just not true, right? All those are, so we're like a lot of people in healthcare, really B2B2C. And so getting the B2B relationship with the employer, the channel partner, the health plan, all that is a hunting license. But, you don't have meat on the table unless you actually hunt. And so we've had to build a whole sort of consumer marketing arm to then go market within these groups that we've signed up to be able to actually get people in the door. We get paid when people come and see us and get primary care from us, not just randomly, right? And then that's what we want. Remember, we're getting paid when we improve their health. We're not going to improve people's health if they never see us. So then we built, our head of growth came from a company called Panera Bread, which is a retail company that does cafes, right? Because it's the same sort of thing. It's about segmenting the market. So we've sort of gotten good at figuring out in the market, who are the people who are likely to want to come to us, and what's the messaging that we need to put forward, and then what's the channels that we can do that. Some of them it's Facebook and Google Ads. Some of it's actually good old fashioned, going to senior centers and pounding the pavement. We call it boots on the ground. And then the hard thing about doing a national business in the US, at least, it's probably the same in India, is that depending on where you are, you might need to change your tactics. That the tactics in a big city like New York are different than in a smaller town of what you do. So again, you need to have a national playbook, and you need to then, segment it by market and maybe change the playbook a bit depending on where you are. So again, it's a great question. This is all about sort of getting people. Now, the good news about these businesses, if you do a good job, is people who like it tell their friends. So really what you need to do when you build practices is the first 1,000 patients are hard. Then the rest becomes easy, right? Because then patients tell their friends, and those people tell their friends, and then this becomes a piece of cake. But so that's the key, is you have to sort of get over the activation hump to get people in, and then treat them well. And that's the best marketing you can do.
And just dwelling on that, a bit further, Rushika, what really convinces those early adopters? Is it experience? And then they become your loyal advocates, or were there any other strategies that you could leverage to try and drive that initial wave of adoption?
Yeah, no, so it's a great question. It's so switching a doctor, which is what we're asking people to do, switch your doctor, is a hard thing. You don't do it because you read a billboard, right? So yes, you should do billboards and do brand awareness, but that's just sort of table stakes. It doesn't actually get people in. It really is. What you need to do is, so there's this diffusion of innovation curve, right, for Edward Rogers, right, where there are people who are just innovators. They're willing to try new things. And what you can do is actually focus on those people, bring them in because they're willing to try something different. Or there are other segments. So movers are a good one. People who move to a new city are looking for a new doctor. So let's do channels where we can get after people who are moving. Let's look at people who are having a lot of health problems that are dissatisfied with the current system. Let's work with partners like in hospitals when people come to their emergency room and they don't have a primary care doctor, right? So find those pockets of people that are easy to convert. Remember, because once you've converted them, now they'll convert other people, right? So the best way people will do it is my friend told me they had a great experience, right? But again, the hard part is those first group, and you go after the innovators.
That's fascinating. And so you've created essentially a pretty strong patient advocacy program for what your offering is, and that kind of drives adoption over time. And another question, and this is a slightly broad one, so Rushika, please feel free to narrow it as you see fit. But are there themes in consumer health in the US market beyond what we've discussed that might hold true for India, even if they're emerging segments in the broader consumer health market of the US that you feel will translate through to markets like India?
I think there are lots, right? So one, I think, and Anthony talked about, it's just the wellness area, where increasingly people are willing and actually want to spend money on things that will make them feel better, look better, maybe live longer, right? So everything from vitamins to exercise programs to genetic testing to, whatever, right? So I think cancer screening, what are things that I can do to improve my health, and people are willing to pay out of pocket for it. So that's one category. I think another category someone mentioned in a prior panel is the aging parents category. Is a huge category, right? Just we have in the US 10,000 new people turn 65 a day. I'm sure the number is higher in India, right? And again, it used to be that your parents lived with you, but increasingly that's not true. You end up living in a different place than them, but it's still your problem. and so how do you create sort of tools and things to help you with your aging parents, right? So I think that's just some examples of things that I think are really getting bigger.
Got it. And I think the last question that I have from the audience, Nandini, is directed to you. If you could talk about how the go-to-market strategy for the consumer health segment has evolved, both during and now post the pandemic. Any change in terms of either the channel mix or the overall approach to the go-to-market?
No, so I think if you think back 10, 15 years, you had to kind of go through the retail channel. You had to distribute your product. Almost, and then advertise. And then, 3 years later, you'd almost know whether it was a success or not when things got expired. So it's a longer term. I think online is a great way to start. It just gets you more feedback. And if you can get enough people trying that, then you can actually use advertising and as a way to build scale. And then the advertising, and both digital and TV, I think is expensive, but worthwhile in actually getting trials. But having the distribution through online, I think at least gets people to start using it. But I think to get scale, as I said, you have to go offline and you have to build that.
Got it. No, thank you. I think, I'll do one attempt at summarizing some of the takeaways from this discussion. But of course, we know consumers are starting to plan ahead. They're just taking healthcare in their own hands and they're researching to a completely different extent. That's also creating, a multi-billion-dollar opportunity. So we're talking of something that's very significant and large. As these consumers are getting more inclined towards self-service, they still expect humanness. And that means personalization, that means empathy, that means support. And for founders who are looking to, lean into this theme of consumerization of healthcare, I think the takeaway is it's important to think non-linearly and not incrementally, because you need to really reinvent things from the grounds up. The way to do that is get to the core of the patient or consumer journey, be out there in the market, get your senior teams out there in the market, see the pain points firsthand and think about them from a first principles perspective. And then take a multi-channel approach to addressing those problems. And so, you need to be online, you need to be offline, you need to handhold the patient or consumer through the journey. And lastly, when we think about differentiation, it is cost, it is quality, it is convenience. And so if we're able to get all of these things together at some level of convergence, we have a chance to really make a meaningful impact. You don't need to target the whole pie. You just need to segment it well enough to do a good job to cater to that segment. And so thank you, Rushika. Thank you, Nandini, for really fantastic discussion, really wonderful insights, a lot of depth and a lot of breadth that we could cover through this conversation. Appreciate your time, appreciate your insights. Thank you.